my name is Taylor Ferrucci. Today is July 7th, 2023, and I'm going to be going over some discharge instruction. Hi, my name's Taylor. I'm one of the surgical technicians today who worked with Mr. Ash. I know I spoke with your husband this morning at drop-off. I've got some discharge instructions here for you. Before I start, do you have any specific questions, or you just want me to go over at-home care?
You can go over at-home care.
All right. So today we did the dental cleaning. Everything went well, but Mr. Ash did have 8 extractions. Because of this, you might notice some slight bleeding or red tinge in the water bowl. We don't want you to worry, but if that does persist for more than 2 days, you can give us a call. We want you to avoid feeding large quantities of food, so just less than half of what you usually would. If you think Mr. Ash is extra hungry and we've kept down our food for more than an hour, you can give just a little bit more. Tomorrow we can go back to normal feedings. We want you feeding soft foods for the next 2 weeks because we did remove so many teeth. Nothing hard, so you can either add a little bit of warm water to your regular kibble or just buy the soft version of that food. We don't want to mix foods right now because that can cause them to have an upset stomach. At the extraction site, we used absorbable sutures, so that means no suture removal is necessary. And avoid lifting the lip in that area because we can put strain on the sutures and cause them to pop. And we want to restrict exercise activity. For 1 day, no running, no jumping. We're going to do leash walks, no unsupervised time outside. After that, we can go back to normal activity, even though we're going to be in the cone for 2 weeks. We want you to keep that on for 10 to 14 days. And Mr. Ash may not go to the bathroom or have a bowel movement for the next 24 hours, and that's going to be normal because we've been fasted. And the drugs we use, the midazolam and butorphanol, can slow down that digestive tract. There's going to be a Band-Aid on the left front arm. We want you to remove that in 2 hours. That's where the IV catheter was placed. And I talked with your husband about how we were going to shave that spot this morning. Any questions so far?
Where do I go if I have an emergency during the night?
So if you do have an emergency, I'll give you a list of clinics. While we're closed, there is an emergency clinic that's open overnight, and then you can come bring Mr. Ash when they close in the morning to us.
Okay.
And then I want you to avoid hard toys in the future, just so we avoid any fractures of those teeth. So if you can't press into the toy, it's too hard. We're gonna send you home with some medications. Rimadyl is an anti-inflammatory, and you'll give half of a tablet by mouth every 12 hours. We want you to give with food. It's a non-steroidal anti-inflammatory, so it can cause vomiting, diarrhea, lack of appetite. If you're noticing those, discontinue and give us a call. And we want you to start the next dose tomorrow because we gave an injectable version today. We're going to send home Tramadol for pain, just to make sure we're as comfortable as possible, and that you'll give half a tablet by mouth every 12 hours with food. This one can taste really bitter, so I suggest hiding it in his dinner. And if you notice he's excessively lethargic, seems very sedate, or tremors, you can discontinue that one. But that one you'll start tonight. And clindamycin or antirobe is going to be an antibiotic because we've broken up all the tartar in the mouth. We want to make sure no bacteria is going to kind of get into the body, and you'll give 1 25 milligram capsule by mouth every 12 hours. And if you notice any signs of GI upset, you can discontinue that and give us a call. Call us immediately if you notice anything. Don't wait with questions on the medication. Do you have any questions now?
No.
All right. And the instructions are going to be printed on each bottle, so you'll have them clear and written out. Just some other general precautions. Mr. Ash might be groggy, seem disoriented, pacing, more vocal than usual. We expect that for the next 12 hours, and it should wear off. That's just because we've had some different medications today. You might notice a slight cough. That's because we used a tube for intubation, and that's normal. It can just be kind of rough on the throat. And check first with us before you give anything else, all right?
Okay.
We wanna see you back in 10 to 14 days, and then we're gonna just assess the extraction site to make sure everything healed normally and clear you to take the cone off Mr. Ash. If you notice anything weird, you can always send us a high quality photo to our email, which I included here at the bottom. And our phone number's on this sheet too. This is for you, and I also emailed you a digital copy.
Perfect, sounds good, thank you.
No other questions?
No other questions.
All right, I'll go get Mr. Ash.